So let's talk about the questions that you're going to ask your interviewer at the end of the interview. Should you ask questions? Yes, absolutely. I think you should have between 1 and 3 questions that you want to ask. I don't think it'll stop you from getting the job if you are the candidate that they want to move forward with if you don't have any questions, but I think it comes off as maybe you're not someone who thinks things through. Maybe you don't care what job you get as long as you get a job if you say no, you don't have any questions for them. A really common question that people ask is, what are the next steps and when will I hear from you? I think those are totally appropriate questions to ask, and I think they read a lot better than a question like, I have another job offer and I would really like to know when I can expect to hear from you because I'd much rather work here and I kind of need a little bit of guidance from you on how to plan around that situation or something like that. I feel like it's much better to just ask straight out, what are the next steps and when will I hear from you, and just leave it at that. But that's just my personal opinion. Another really popular question that people ask is, what is the culture of the unit? I personally don't love this question because I feel like if the answer would be anything negative, the interviewers aren't going to be able to answer that honestly without being inappropriate. So, like I said, it's a really popular question. I don't think there's any harm in asking it. It's just not my favorite question. Another question that's really popular that I do like, I think it makes it look like the person being interviewed is someone who likes to be prepared and know what they're signing up for, is, can you tell me about the patient population on the unit? I think it will help you know if you might be signing up for something that you're not interested in. Let's say there's a lot of a certain type of patient. Like, let's say there's a lot of trach patients and you tend to be someone who likes more like GI surgeries, or you're more of a cardiac kind of person. If they tell you the type of issues that their patients normally have that gets kind of trafficked to their specific unit, it'll help you make a decision about whether this unit is right for you. I do have a personal favorite question, and it is, what goals are you working towards on the unit right now? And the reason I love this question is because managers love to talk about the goals that they're working on. Common goals, for example, would be like reducing infections, reducing falls, reducing pressure injuries. Most units have sort of metrics that they're working on improving, and it is something that managers like to talk about. And then when you're writing your thank you note later, you can mention that you loved hearing about working on X, Y, and Z goal, and that you would love to learn more about how they're doing that and work together with them on their goals towards making that happen. And it makes it sound like you listened and you are sort of talking about what you can do together instead of just, I'm the best candidate, let me review all my good qualities in this thank you letter. It's a little bit more engaging, I think, to get the managers talking. Another question that I love that I think has become more popular recently is, if I were to get the job, what would be the best way for me to prepare in the meantime? I think this question comes off as someone who likes to be prepared, someone who takes responsibility, who's mature, who's ready to put in the work for the job. And I think all of that comes across really well. Another question you can ask is one that sort of gets them talking, which is, when you think of a really great nurse, what qualities do you think of? Or what do you feel makes a really great nurse? You kind of have to read the room on this, because if you feel like they're sort of in a hurry and they're not sort of in a mood to, kind of individually go through and talk, it might put a little time pressure on them. Or if you feel like, you've read the room and you feel like it's a good question to ask, it allows them to tell you what they think is important to them, and it lets you know what they're looking for and can maybe help guide some of the things that you say either at the end of your interview or in a thank you letter later. You can tie in something about how it really spoke to you when they mentioned this quality, because that quality has always been really important to you, and you're so glad that you got the opportunity to meet with them, X, Y, and Z. And like I said, just read the room before you ask that question, because it can be a little bit overwhelming if the interviewer is already pressed for time. Another question that I like is, can you tell me a little bit about the orientation process? I like this question because it shows, again, that you like to be prepared, that you want to know exactly what it is that you're signing up for. And it'll give you information about what your job will be like. Are they going to give you 2 weeks as a new grad and then expect you to be on your own? Are they going to give you, 9 weeks with a preceptor? Are you going to have classes that kind of help you run through the policies and procedures that are specific to the hospital? Are you going to have 5 different preceptors, 1 preceptor? A lot of these questions that will help you sort of mentally prepare for what it is that you're walking into. Let me know in the comments if there's any questions that you are thinking about asking and you want to know how it might come across to an interviewer. I'd love to hear what questions you guys are curious about.